Hello everyone. Welcome to our presentation on PTSD, or Post-Traumatic Stress Disorder in the military. My name is Dr. Jared Skillings. I'm a board-certified clinical health psychologist, and this presentation was designed by myself and by Dr. Sarah Grushka. Let's start by answering the question, what is PTSD? Post-traumatic stress disorder is often called PTSD. It is an anxiety disorder that happens after someone experiences or sees a traumatic event. Combat-related PTSD in the military is very common. Some of the traumatic events that happened in Operation Enduring Freedom or Iraqi Freedom include artillery, rocket, or mortar fire, gunshot, being attacked or ambushed, seeing dead bodies or human remains, or knowing someone that was seriously injured or killed. Who gets PTSD? Anyone who has experienced or witnessed a life-threatening event can get PTSD. Any of the traumatic events on the previous slide would qualify. As many as 1 in 5 deployed service members, that's 20%, can develop PTSD. And you can get PTSD no matter how strong you are. There are 3 different types of PTSD symptoms. One is re-experiencing symptoms, or reliving the trauma. This includes flashbacks or nightmares of the trauma. 2, avoidance and numbing symptoms. These kinds of symptoms include staying away from people or places that remind you of the trauma, or feeling numb. And 3, arousal symptoms. So feeling on guard, feeling irritable, or being too easily startled. PTSD can impact you in important ways. It can impact your body, feeling tired or having an upset stomach, muscle tension, elevated blood pressure. It can impact your emotions so that you feel numb, sad, maybe helpless or angry. It can impact your thinking so that you cannot concentrate, make bad decisions, or have trouble with your memory. PTSD can also impact your behavior by causing you to avoid people, becoming tearful or too easily startled, drink too much alcohol or use drugs, or behave in an angry way. It can also impact your spirituality, leading you to have difficulty forgiving others, doubting your beliefs, or difficulty trusting God or other people. There are ways that PTSD can get worse. Lashing out in anger or using alcohol or drugs can make it worse. Negative coping can also make it worse, such as avoiding people or purposely avoiding things that remind you of the trauma or not doing much activity. There are also ways to fight back against PTSD. Here are some positive coping strategies. Learn about PTSD. Do some research. Talk to your doctor about PTSD and treatment options. Practice relaxation skills. Exercise to reduce stress. Set realistic goals for yourself for each day. And break up large or difficult tasks into smaller ones. Set some priorities for which one is important and do what you can. Other ways to fight back against PTSD include spending time with other healthy people, talking to trusted friends or family members. Tell other people about things that may trigger your symptoms to get worse. Expect your symptoms to improve slowly, not immediately. And look for comforting situations, places, and people so that you can take refuge and feel better when you're having a lousy day. There are treatments that are very effective for treating PTSD. The first one is called cognitive behavioral therapy. CBT has been shown to be very helpful for people and military service members with PTSD. In this treatment, you meet with a psychologist or social worker once a week for about 3 to 6 months. There are 2 specific types of cognitive behavioral treatment that have been shown to work. They are called prolonged exposure and cognitive processing therapies. There are 2 medications that are approved by the Food and Drug Administration and the VA for the treatment of PTSD. Those are called sertraline or Zoloft and paroxetine or Paxil. Thank you for listening to today's presentation about military PTSD. I hope this information was helpful. Have a terrific day.